Congratulations! You are now about 10 weeks out from your arthroscopic shoulder surgery. Today, I want to review what you can typically expect at this stage of recovery and how to continue progressing safely. Depending on the type of surgery you had, this is usually the time frame when the repaired tissue has had a chance to heal. For patients who had a rotator cuff repair, around 10 weeks is typically when the tendon has healed back to the bone, enough that strengthening can begin and gradually progress. If you had a biceps procedure, this is also the time when strengthening will usually increase. At this point, it is very normal for your shoulder to still feel weak. It is also normal for your motion to still be improving. Soft tissue procedures take time to recover from, and strength is usually the last thing to return. For a biceps tenodesis, the typical full recovery is around 4 to 6 months. For a rotator cuff repair, the typical full recovery is closer to 9 to 12 months. During that recovery window, strength usually takes the longest to rebuild. Even though you are making progress, I still want you to be cautious with your operative shoulder at 10 weeks. Please avoid heavy overhead lifting, sudden jerking motions, or explosive activities. A common example is trying to start a lawnmower. Your muscle still needs time to rebuild strength. If you do something too forceful too soon, that force can go back through the tendon and potentially compromise the repair. For patients who enjoy golf, I typically allow some light putting and chipping around this stage. If you had a rotator cuff repair, I would avoid swinging a larger club until at least 4 to 5 months after surgery. If you had biceps surgery alone, most restrictions are typically lifted around this point, and you may begin progressing activities as tolerated. The main exception is if you are a thrower. In that case, this is usually the time to gradually and slowly begin a structured throwing program. By now, you should either have already had a scheduled follow-up appointment or have one coming soon. At that visit, I will often ultrasound my rotator cuff repairs to assess the integrity of the repair. This helps guide the next stage of recovery. The ultimate goal is a healed tendon. Unfortunately, some rotator cuff repairs can fail, and when they do, it is most commonly within the first 4 months. Fortunately, this does not always mean more surgery is needed, but I do like to know whether the tendon appears healed at this stage. Lastly, if you are still in therapy and it is helping, you may continue therapy at your convenience. Once you are in the strengthening portion of the protocol and feel comfortable performing most exercises on your own, it is usually okay to stop formal therapy. This is something I will discuss with you or may have already discussed with you in person. For rotator cuff patients, I will typically see you back again in a couple of months to check your overall function and continued progress. Please contact the office with any questions or concerns.